Hi, I'm Sam from Community Action Network. We're an award-winning infrastructure charity based in Dorset, working alongside our communities and together with partners such as health and social care to help shape services fit for purpose. We're really passionate about ensuring our community voice is involved in shaping the services we all use locally. I'd love to talk to you today about an NHS approach, which our local NHS body, NHS Dorset, is exploring and testing out locally for people living in Dorset. It's called patient activation. So, what is that? Activation describes someone's knowledge, skills, and confidence to manage and be part of their own health and well-being. We've been asked to test out the approach with communities and local people and feedback views. A healthcare professional, such as a GP or community nurse, as part of their appointment with you, may ask a single activation question you can see on screen now. Someone's answer to this question will then determine how involved they are in actively managing their health, and this will determine what is offered to them as a result. Okay, let's break it down. When it comes to health professionals using the answer to the question we saw earlier, how good are you at taking care of your health? And the answers they receive will help to identify someone's activation level. At level 1, someone may feel laid back, disengaged, or overwhelmed about managing their own health. They may not understand their role in the process and how they can positively contribute by staying active or eating well, for example. Level 2, this person may lack the knowledge and confidence to manage their health, or how they can add small changes to their lifestyle. Level 3, someone appears to be taking action, but may still lack the confidence to support these behaviours, signing up to take part in an exercise class, or joining their local church, community group, or lunch club. Level 4, a person has taken on many of the behaviours needed to support their health and is able to maintain them in the face of everything that comes with everyday life. Let's try this out in terms of activation, but with a cooking activity. Does anyone remember the days of Ready, Steady, Cook? Let's imagine you're given a box of ingredients. You may not have used these before, and you've been asked to cook this for a large gathering of people. Have a think about where you might sit in terms of activation levels. Level 1, you'd feel uncomfortable and you'd worry that you struggle with the recipe and ingredients. You wouldn't feel confident to do this or to ask for help. Level 2, you give it a go, but might not be very confident with different ingredients or cooking methods, but you might ask for help. Level 3, you know you can make recipes you're comfortable with, and you're confident you could apply your skills to a new recipe. Level 4, you regularly try out making new recipes and you enjoy cooking and using different ingredients. You'd give it a go and pretty confident you'd rustle something up. So rate yourself from 1 to 4 on your knowledge, skills, and confidence in this scenario. This follows the tool and measurement of how someone rates themselves at managing their own health. So why does this all matter? This approach has evidence to say that people who are more actively engaged in their own health have better life outcomes. They may live longer and with less ill health in later years. The NHS know that increasing people's activation levels are possible. They need our help to spread the word and to help describe it to others. So let's have a think about, how do you feel about the single activation question being asked? How do you feel if you were to be asked this question and that it would result on the care that you are offered? What might help people at different activation levels to increase their knowledge, skills, and confidence to take care of their own health? Do we think that social and peer support from neighbours, communities, and voluntary sector groups would support, motivate someone to look after their own health and well-being? How would you describe this approach around activation if you were to tell a friend or family member? Thank you so much for listening. please do fill out our short questionnaire by scanning the QR code.